something that you can get just over the counter melatonin. Do you find that that heavily impacts how our body just responds on our baseline biological response, I guess, for sleep?
So, melatonin is a big question and a big part of the pharmaceutical industry. And I think it has its uses, but there's not enough evidence in a lot of cases for using melatonin. So, our body produces melatonin naturally. And that's one of the reasons why a lot of people are drawn to that supplement. The other thing that I have questions about with melatonin often is it's not well regulated. And so there was a study that came out a couple of years ago from a university where they went and bought 40 over the counter melatonin supplements and they tested them in the lab. And they contained anywhere from 0 to 400% of what the active ingredient was. And so
Wow.
if somebody's going to use melatonin, I often encourage them to go and make sure that they're getting a prescription grade or a pharmaceutical grade that's appropriate. But melatonin for the average person is not something that they necessarily will need. It can be used in small doses to adjust sleep cycles. It can be used for things like REM sleep behavior disorder, but it's something that has a lot of hype, but the evidence there for me is not where I'm comfortable usually recommending it as a frontline treatment. If somebody's already on it, we might talk about how to use it in a way that's going to work with their biology rather than against it, because the dosing does matter and the timing matters a lot. But I just really encourage people to be cautious about melatonin.